Now I'll turn it over to the SHIRT team.
Thank you, Kim. This is Sally Buck, and CEO at the National Rural Health Resource Center, and we are the TA program provider along with our subsidiary, Rural Health Innovations, for the Small Rural Hospital Transitions Project. And on today's call, we have a number of our SHIRT team members, as well as panelists who participated in the summit that developed the strategic value-based strategy map and balanced scorecard that we'll be presenting. So on today's call with me is Terry Hill, our Senior Advisor for Rural Health Policy and Leadership, Bethany Adams, Senior Program Manager for the SHIRT project, and Rhonda Barkus, Program Specialist also for the SHIRT project. And the project for education and outreach of all SHIRT materials is through the National Rural Health Resource Center through a cooperative agreement with the Federal Office of Rural Health Policy. And the SHIRT project really fits under one of our 5 focus core areas: transition to value and population health. And the SHIRT project supports small rural hospitals nationally in bridging the gaps between the current value-based healthcare system and newly emerging value-based payment and care systems. And we provide on-site technical consultations to 9 hospitals per year, as well as provide education and outreach to disseminate best practices for all small rural hospitals and networks and state partners. We also are the technical assistance provider for the Rural Hospital Medicare Rural Hospital Flexibility Grant Program, or FLEX program as it's known, through the Technical Assistance Services Center. We are a network technical assistance provider for Rural Health Network Development and Allied Health Workforce Training projects. And we provide TA to the state SHIP, or Small Rural Hospital Improvement Program, and also HIT is a focus area, and we staff the National Rural HIT Coalition, and Workforce, our final focus area that we support through the network grants and also through consulting services. So our objectives today for the presentation are to present findings from the 2017 Rural Hospital Value-Based Strategic Summit. And through this summit, we developed a strategic plan to help transition hospitals and networks to value-based care and population health. And we'll be sharing the key transition strategies and then actions identified from summit panelists, and also best practices in using strategy map and balanced scorecard templates for hospital efficiency and decision making. And finally, we'll be sharing the Small Rural Hospital Transitions Toolkit and giving an overview of the resources available through that. The summit was held in May of this year and was supported by the Federal Office of Rural Health Policy through the cooperative agreement. And the purpose was to provide leaders with templates to improve organizational planning, really strengthen those actionable steps, and operationalize key strategies that will enable hospitals and networks to effectively transition to value. And the summit brought together 12 panelists and 3 of us as staff facilitating the discussion. And our panelists included chief executive officers from 3 of our SHIRT participating hospitals who had received technical consultations. We also include State Office of Rural Health directors and FLEX coordinators, network directors, state hospital associations, a financial quality consultant, the Federal Office of Rural Health Policy, and Rural Health Value, a fellow technical assistance provider. And here's a list of those panelists who participated. And we're thrilled that a number of them will be on the call today and sharing some of their highlights from the panel. Terry will provide some background on the summit, why we convened that, and the strategy.
Thank you, Sally. And again, this builds on a series of summit meetings that we've had over the years, starting with the creation of a blueprint for value. We had two summit meetings last year focusing on provider engagement and also focusing on financial leadership moving into value in that regard. So what we're continually evolving this process, and one of the things we found that we're missing was kind of an easy to follow template for our rural hospitals. Basically, you kind of fill in these sections, and if you basically follow these processes, use these templates, you're going to build on what the early adopters have been doing, the ones that have been successful, the new ACOs, et cetera. And you're also going to build on what the summit leaders, and these have been really stellar groups from a year-to-year basis, you know, just this broad context, folks that are working on the ground, folks that are looking at this from more of a research perspective, folks that are running state programs and state associations, et cetera. So one of the things we went back on was let's look again. Let's start from the beginning. What are we doing here? Why is this changing? And in essence, it's about the triple aim. Taking the Institute for Health Improvement's triple aim and taking it seriously. So it's about better care plus smarter spending actually equaling healthier people. And one of the things that we found is that there is an indirect correlation between the amount of money that we spend on patients and the level of quality. In fact, what we see as we look on a state-by-state basis is that the more money we spend in the treatment of Medicare patients, the lower the quality. And a lot of that just has to do with overproduction, too many tests, too many drugs, et cetera. And so there is this room for improvement that if we're smarter in our spending and we're better in our quality processes, we're going to have healthier people as well. So, next slide. And this is pretty much saying the same thing. We're going to need the new game here. There's a new era of healthcare payment, and it has to do with value. So in order to be successful, even though critical access hospitals have not been mandated or highly incentivized to go into these quality models and into these value models, we're going to have to demonstrate our value by increasing the quality of care and the patient satisfaction while reducing the cost and the overutilization as well. So we're going to have to play in this value field. And the value, again, here is defined as improved quality and patient satisfaction relative to reduced utilization and costs as well. Now, the rural hospitals have really got to understand that this is really a relatively large market. So they're going to have to really take a look as we're spreading the responsibility for the patient beyond our hospital borders. We need to be thinking through what the metrics are going to be in order to demonstrate our value. So we've got to be thinking about whether or not we're going to be in accountable care organizations, the relationship that we're going to have with our community, with these bigger healthcare systems, et cetera. So as we look at demonstrating value with these metrics, we've really got to start looking at this whole area of population health. For example, are we improving the diabetes rates in our service area? One of the things we have here at the center is a mechanism to calculate where you're standing on a population health standpoint, and it's a portal, and I recommend if you haven't come in to that portal here at our center that you do so. It's about patient experience. What sort of experience did the patient have? And again, increasingly, it's not just in our hospital, but looking at the pre-hospital care, post-hospital care, home care, et cetera, and being able to define those outcomes and define that value. Per capita cost is becoming a huge measure in these value models. So how much does it cost to do a great job of taking care of a patient is becoming extremely relevant. And we know that we have an advantage in rural. Our per patient cost tends to be lower, even though some of our services are more costly. So we need to build on that. But by all means, we have to document it as well. Rural relevant measures, again, HCAHPS scores. We really encourage all rural hospitals to be doing HCAHPS. They're kind of the patient satisfaction gold standard. We need to be looking at our mortality rates, the total cost per member per month, which is a term directly from the ACO language. And one of the other things is we've got to look at ED utilization rates and costs, because this has emerged as a major problem. So the appropriate use of the emergency room, diversion programs to more appropriate care are all really very important and need to be quantified. So given that definition, or the Institute for Health Improvement actually has a menu of triple aim outcome measures. And what you're going to see is in what is happening here is in these templates, we're going to provide direct links into IHI's measures. We're going to make it extremely easy for our rural hospital leaders to log into resources that are available, and also to make sure that these are going to be appropriate for their smaller hospitals and for this rural setting. Now, what we basically, this is the product of this summit meeting in terms of the recommended strategies that should be incorporated into any rural hospital's movement into value. The first has to do with strategic planning. And in some of our interviews with the early adopters, the successful ACO leaders, they're basically saying that we really need to create this shared vision of value and understand the role rural hospitals and providers have in this transition to value. So we need to do strategic planning on a more frequent basis, at the very minimum, on a yearly basis. Our value strategies, the transition to value strategies, need to be incorporated into that strategic planning as well. We need to make an investment in leadership and leadership education as well, and develop programs that include boards of directors, managers, and clinical staff. So this was another big piece of the puzzle. We've got to engage our providers, and we've got to provide leadership training to our managers, and we've got to make sure that everybody understands what's going on and that the leadership is aligned. And then we've got to kind of take this and find an alignment and build interdependence, such as affiliations to support value-based models, et cetera. So leadership is always important, and it can't be neglected. It needs to start with education, it needs to move into alignment, and it needs to be a major part of our initial work, and then ongoing support as well. Under that is customers, patients, partners, and community. Now, given this larger responsibility for patient care, we're going to have to engage other community resources and look for these collaborative relationships. So this is one of the recommendations coming from our summit group. We're going to need to tell our story to the community and staff to promote quality of care and market services. And we're going to have to advocate for policy and regulatory changes. So if we want that support, if we want to stop out-migration for care and a greater understanding of the services we have available, the reasons we're making some of these changes, et cetera, we're going to have to tell our story. Under that is measurement, analysis, feedback, and knowledge management. And again, we're using this performance excellence blueprint as our framework here. And data and information, particularly patient information, becomes crucial here. We've really got to move the dial in terms of our effectiveness. We've got to reduce some of the costs that have been a result of overproduction, and just basically look for more efficient ways of managing our patients. And we've got to use that data for quality reporting and ensuring that we are on course in terms of our strategic direction as well. So one of the things we're going to be recommending here, and we're going to be going over in some detail, is a balanced scorecard that can be used for this purpose. It'll be our communication tool, it'll be our measurement tool, and it'll help to guide our strategic progress. Another area that is extremely important and often gets neglected is workforce, back at the top here. We've got to engage and educate managers and frontline staff on value-based models and emphasize team-based support. I see so many cases where the staff doesn't really understand what's going on. Managers are following directives but don't really know why the changes are taking place. So workforce has got to be engaged, and we've got to use as much education as we can, and then really assess the culture to obtain feedback on needs, development, improvement, and employee recognition. This type of change is massive, and culture change is something that we have to be mindful of. We have to measure. We have to make sure that our staff is along with us as we move in this major new direction. I'm going to go to operations and processes because, in essence, again, building on some of our previous summit meetings, we've got to make sure that our financial and operational and clinical processes are as efficient and as lean as possible. And we've got to redesign some of these processes for these value-based models as well. We're going to have to ensure that the patient care continues beyond the hospital doors into the various other follow-up services as well. If we do all of that, basically we're going to not only have better impact and outcomes, but we're also going to, it's going to be really important that we measure those outcomes and be able to then provide that in terms of measuring our value, in terms of promoting our hospitals and our services, et cetera. So those were the recommendations that came out of our summit group, and let's see if we can get a few folks on the line here to speak. In terms of our hospitals, we had 3 really good hospital administrators who were really, really pleased with the level of involvement of all of our summit panel. But Greg, Michael, and Tom were all involved. Will one of you be willing to talk a bit about how these templates are going to be of value to your hospital?
And press *2 to unmute your phone line.
Well, let's turn to, how about anybody else, either Dave or Elizabeth, Rebecca, or Gina, who represent the hospital associations. Can I get one of you to make a comment?
Again, it's *2 to unmute, and if you just want to share from your organizational perspective as a state partner network director, how the strategies we've identified, actions and templates will benefit your members or your hospitals. And our other participants included the Flex Monitoring Team. John Gale was a participant, as well as Carla Wang from Rural Health Value, another TA provider.
John, we know you're on the call and you're always good for a comment here. Would you mind just talking a little bit about your experience?
And star 2 to unmute, or you can put comments in the chat box. Well, through the work at the summit, as Terry said, we reviewed strategies from the previous summits on financial leadership and provider engagement, and kind of then revisited those. And then the group worked on what actions or initiatives are needed to achieve these strategies. So we gathered that information. They then worked on identifying measures for hospitals and networks to look at their progress towards these strategies and what sources of information and then resources needed. And so our outcome from the summit is we've created the value-based summit guide and a strategy map template and the balanced scorecard template. And those are documents that we've left in Microsoft Word, and that allows leaders to develop and execute a strategic plan that they can look at these key value-based strategies as well as align with initiatives and strategies from their own board and their own hospital, and then incorporate it into an overall transition to a value-based system and position for population health. And the strategy map and balanced scorecard will be walking through our based on established frameworks that we created through both the FLEX program and the previous Rural Hospital Performance and Improvement Program. And the resources are listed on our website. This is a screenshot from the website, and you can see the guide can be downloaded as a PDF as well as the 2 templates. Great, and I see, John, that from University of Southern Maine, part of the FLEX monitoring team, that you're on the call. Would you like to share from your position how you see these templates and guides that were created to benefit hospitals and networks? Okay, star 2, so unmute the line.
There we go. I was having a hard time finding something to say because I was listening to my computer. When I logged in, I just went directly to that, and I wasn't figuring it out. But I think the templates, one of the things that is always striking for me as part of the summits is the practicality of the work that comes out of the group discussion and group thinking. Having the hospital administrators there, I thought, and it was incredibly important and raises, to me, I think one of the important issues of culture and how the hospital embraces change and willingness to take on projects to move towards value. And to me, as we talk to hospitals, that is just such an important part of it. But from that, I think the templates and the tools really give some very practical hands-on tools for hospital staff and administrators to move forward. So for me, I'm always impressed by the practical nature and the direct applicability of the tools in hospitals of all sorts. So it's always a pleasure to be involved in these summits, and there's just such good work that comes out of them.
Thank you, John. And I can see we have a number of FLEX coordinators and State Office of Rural Health Directors, so we're really encouraged by that because you are a trusted resource to the hospitals and networks in your state as well. And so from building your familiarity with these tools, seeing how they can be referred to hospitals or to the activities you're doing through your Plex program. Well, I'm going to turn it over to Bethany Adams, and she's going to walk through the two main templates we have and show some examples from the Strategy Map Scorecard. Bethany?
Thanks, Sally. So to take the information that Terry and Sally, John discussed up front, to pull all those key transition strategies from the PE format, which provides a systematic way of thinking, and then stepping it down to help the network leaders and providers to actually apply in a meaningful way, to apply these key transition strategies to their organizations. The summit panelists developed a strategy map template. The map is really designed to help leaders, providers to simply, high level, conceptually operationalize these strategies and even more importantly, communicate them, again, in a meaningful way to a broad audience, and that is the board, the medical staff, the hospital staff, etc. So that's really the first key thought, real function of the strategy map, to help this leaders and providers just think about a visual tool to help communicate the direction where they want to send their hospitals for the future. So then the panelists actually took it one step further. They developed the strategy map into a Word document and pre-filled it with these strategies into initiative-type formatting, and followed the balanced scorecard themes. So it's in a Word format. It's very easy to adopt by any organization, and they can easily adopt it by just simple edits because it's in Word format to fit their hospital or network strategy plan, or if they don't have one, and still some organizations still don't, or they need to update theirs to reflect value and the future of the healthcare, they can simply even just utilize this full template. So we have a screenshot here of the template. It is in this format in the PDF guide, but it's actually this format as well in the Word document. So for each of those strategies, there easily can be edited and adopted to fit the organization. And just to tie back to the PE strategies map that you saw that Terry discussed, those strategies are also included as a checklist format to have in hand and help guide decision-making throughout the whole strategy planning process. So it's all pre-made, ready to go and help guide the user. So the summit panelists just didn't stop there. They wanted a full working document to help the leaders and providers out there to make it useful, meaningful, and to apply these strategies in an easy way. So therefore, they created a balanced scorecard template. So they even took it, like I said, one step further by even considering not just the key transition strategies that were identified in the 2016 Financial and Leadership Summit from last year and then updated it. They utilized that along with the actions that were identified and again updated it to develop a whole working example of a balanced scorecard. And the Balanced Scorecard is a fantastic tool that's been proven time and time again, not just in other industries, but right here in healthcare. It's a fantastic tool to draw performance and to help the leadership effectively, efficiently execute and implement a strategic plan, help them to monitor, are they moving toward their strategic goals, and in a meaningful way help them plan for the future. So the template itself, again, it's in a Word document. The guide comes as a full working example in all 4 of the key areas of the Balanced Scorecard, and even includes common metrics, hospital target levels, and identifies performance areas that are considered, say, priority or most commonly addressed by many of the hospitals. So here is an example. So right from the guide, we envisioned that this would be a tool that either an executive or a manager would literally take it, has all the information so that you can apply it. It has full working examples. You just see a little snapshot here that helps explain how to develop it and what is considered strategic objectives, what actions you need, how to measure, what's your target. And we had to divide the template into 2 screenshots here. And even help you think about how to monitor this over time. Again, you're just seeing just one example tied to the learning and growth theme area, but there are many examples for all areas of the Balanced Scorecard for you to follow. Now, the Balanced Scorecard template, when you download it, is completely blank. And so it's very easy for the hospital, the network leaders, providers to simply utilize these examples and create their own and tie it back to their hospitals and network missions and values and strategic plans for monitoring their performance. So here's an example of right from the guide again. We're following along, just utilizing the learning and growth areas. We provided the examples of performance areas that you can consider that could tie to what you want to monitor, common measures and target levels, data sources, and then, of course, the summit panelists also wanted to provide some steps to help provide some suggestions to other leaders to help to monitor performance and identify measures moving forward. So the summit panelists created a product that is, I want to say, one-stop shopping, so to speak. It's a full document that should help any organization who doesn't have a strategic plan, who doesn't have a strategy map, who doesn't have a dashboard. You can easily now take this and create it for that organization in a matter of, I want to say, hours. It's a full working template to make it simple. We have found through the SHIRT program and the other programs here at the center that this is just such a large need for the hospitals and leaders, and at the same time thinking about how to actually utilize this in a meaningful way to move forward toward the future. This provides them a full working guide. Thanks to the hard work of the summit panelists, and thank you again one more time to the panelists. It was fantastic working with you. So I will pass it on now to, I believe, Rhonda.
All right. Thanks, Bethany. So
So all of the materials that Bethany's just shared, all of that will be housed on the toolkit, and we have created the Transitioning Value-Based Systems Toolkit, what we call the toolkit, about 3 years ago, and originally it was a PDF document with links embedded so that a person could access the tools easily. Last year we actually moved from it being a PDF document to being a portal system, and because we really wanted to make it more interactive and easier to use. And then this year we're updating the portal system to make it even more user-friendly than it was in the past. And so the toolkit was developed with the support of FRHP to help disseminate some of the consultant recommendations from SHRP project and also from our past RHPI project, to be able to share those with other hospitals that maybe had not participated, to give them some key strategies, transition strategies, to think about moving towards the future of healthcare, to share a little bit more about distributing the tools and implementing those, how to best implement the best practices, and to share some of the evidence-based methods that have been provided from other nationally recognized organizations. So the toolkit, who should use the toolkit? You know, any rural providers and leaders are able to do that, whether it is a rural provider such as a hospital, it could be the CEO who accesses it, it could be the manager of a department, it could be a CNO. So it's really, I think, available and user-friendly to a lot of different folks within a rural providership. And the first thing, though, that we encourage people to do is to do the self-assessment for transition planning. And so, and I'll talk about that in just a moment. So the toolkit, the portal has different pages, and you can see here that there are 8 different sections, and each section deals with a different area that is tied to some of the past consultant recommendations, and especially the ones that are proving to be most helpful. And so you can see each page is very different, but again, some are very probably relevant for the CFO, some for a CNO, and some for other types of providers. And so what we encourage folks to do is to perform the transition self-assessment first, and then also to go ahead and complete the community health needs assessment, just to make sure that the strategies for the hospital or the organization are in alignment with what the community needs are. And then go ahead and apply the Performance Excellence Blueprint to develop the systems to deal with those strategies. And Terry had talked earlier about the Performance Excellence Blueprint and those 7 different areas. And then we encourage them to also use the tools that Terry, Sally, and Bethany had talked about earlier that came out of the summit, the templates, the tools, and the resources to be able to actually move this forward. And all of these tools are found now on the toolkit under the strategic planning section. So I was mentioning earlier, the first thing that we encourage folks to do is to complete the self-assessment. And the self-assessment covers seven different areas that are aligned with the Performance Excellence Blueprint that Terry had shared earlier. It's 116 questions, so there's a possible score of 116 covering those 7 areas. So once the person completes the self-assessment, they will get immediate results. And so the results can be accessed at that moment, but they will also get an email that shares the results of their self-assessment. The self-assessment will talk about each of those 7 areas, and we'll go through every question, every item, and make suggestions for related resources that we have on the toolkit that would apply to help that person to or that organization to make improvements in that section. So it's very specific and very, John Gale earlier used the word very practical. And so again, it's very practical. So they have an issue with a certain item or a certain category, and it is immediately linked to a resource source on the toolkit. So they don't have to do a whole lot of searching around for it. And so, for instance, let's just say that a CNO or anybody in any organization goes on the quality improvement page, and this is what the page is looking like. One of the things that we've added this time is you can see on the left hand, the top left side where the bullet points are, those are all the different categories that are listed in the QI page. It used to be that they had to keep scrolling down to be able to access those categories. Now they can very quickly look at them and say, oh, I need to look at discharge planning. They can click on discharge planning, and it will take them directly to that section that gives them ideas for discharge planning. And so when they click on that section, they'll go down, for instance, to discharge planning. What they will see is a list of suggestions and resources and tools that will assist them in improving that area that they're looking for, and in this case, discharge planning. As we were putting the toolkit together, we were very mindful we wanted to make sure we did not overwhelm people with so much information that they didn't know where to even start. So we did a lot of research. We explored a lot of tools, resources, websites, looking for some of the best of the best, so that folks would have a really good, solid tool or resource to start with instead of having to do a lot of searching. And so we chose resources from organizations such as IHI and AHRQ. And so let's say, for instance, again, an organization decides they're wanting to look at discharge planning. They click on that. It takes them down. And so then what they would see are some resources such as the IHI Smart Discharge Protocol Toolkit, or perhaps the AHRQ teach-back method. And so if they decide they're needing to look at discharge planning, because we know that that is going to impact the outcome for the patient, good discharge planning is going to impact HCAP scores and also readmission rates, really important. So if they went down and started looking at some of those resources, then one of the resources they would see here is the AHRQ, the teach-back method. And so they would click on that link, and it would take them directly to that page so that they would have all of those resources, again, at their fingertips in a very easy way in just a few clicks. And so here they would be able to look at information that would give the rationale about using teach-back methods, and it gives them videos that they could use and tools that they could use to help nurses learn how to do teach-back and to improve their competency around it. So again, very simple, very straightforward, and very easy. Here's one other example of one of the pages, which is the financial and operational strategies. On the left, again, you can see the bullet points that summarize the topics that are on that page so that they could quickly go to one of those topics. Also, though, on the right of that screen, what you see are the suggestions for like webinar playbacks, hospital spotlights, our performance management group calls, because those are really great resources for folks who are using some of the tools for the first time. But those are the resources that help the users to discover more about how other hospitals or other organizations have actually used the resource and been able to use them successfully. So it's not just the tool and the resource, but it's also this other piece of hospitals and other folks who have successfully utilized those tools and how they did that, and then what were some of the lessons learned as they were doing those things. So this is the toolkit. Again, all of the information today shared from Sally and Bethany and Terry are on the toolkit, specifically under the strategic planning page. All right, and so that is all I have on the toolkit. I will pass that back to you, Sally.
Yeah, thanks, Rhonda. And again, thank you for highlighting the toolkit, which actually has had a whole upgrade recently, and has an easy way to navigate through the resources, as Rhonda demonstrated through those 9 topic areas. And again, is there, again, with so many of you being from state offices, flex programs, hospital associations, that these best practice recommendations from SHRT in the transition to value are key activities that can be used within getting ideas for flex activities, as well as being able to highlight the lessons learned from some hospital spotlights. So we wanted to announce the Small Rural Hospital Transitions application period, and this will open on Monday, September 25th, and then close about 3.5 weeks later on October 16th. And again, this application is for hospitals who are in the eligible counties of persistent poverty and 49 beds or less, that they can apply for an on-site consultation in a financial operational assessment or quality improvement assessment and action plans for both of those. And we have openings for 9 hospitals, and the application is on the SHRT project website, and actually there's a preview of the application and the self-assessment, as well as the hints to submitting a strong application and direct links to the online application, which will go live on the 25th. And you can see up there on the right side is the landing page for SHRT for the application, and the information for eligibility and the types of projects is on the right in the green box as well. And I know we have folks from FORHP. If there's any comments on the summit or toolkit, I'll open it up to everyone if you have any questions or comments. And then just a reminder to please complete the short online assessment, and that's required if you are requiring credit from the American College of Healthcare Executives. And then we have links there to the toolkit, upcoming webinars and calls when scheduled for the next program year are linked, as well as playback. And also we have podcasts available of all of our performance management group calls and webinars, so you can take them on the road as well. So thank you for the comments on the toolkit. And again, if you have any questions or would like a one-on-one walkthrough, our team is happy to go through that, and Bethany's noted that, and Rhonda has done that as well for hospitals and for state offices.
You know, Sally, one final comment. We were just talking about that several of our summit members came from Texas. So they had told us they were going to be on the call and aren't on today. So we want everyone to know, and I'm sure everybody shares our concern with what's going on there. Rural hospitals become enormously important in this type of a tragedy, et cetera. So we want to pass, even though they're not here, we want to pass along our best wishes and our staff to the folks in Texas and all the rural hospitals, the state office, et cetera, in Texas.
Great. And I see Lois has a question about getting a hold of Bethany, and we do have contact information on our final slide. And Kim is also putting in an email and phone number as well. Again, we encourage you to download the templates and share those with your hospital, or if you are a hospital, to take a look at those with your leadership team. And we've worked with one of our panelists from a hospital in South Dakota. We were able to go on site and help them design their strategy map and scorecard, and they felt it was a way to really bring the strategies and measures to the entire staff at the hospital, not only the board